Over to you, Dr. Lynda Sirigoi. Thank you. You have 5 minutes.
Thank you, Anne. We all know that vaccines have been around for a long time. In fact, vaccines have changed the world through eradicating many life-threatening infections over the years, allowing people to live longer. Vaccines have saved millions of lives and continue to save lives as we protect children and adults against deadly infections. The fact that we're all here today is because our parents were wise and responsible to have us vaccinated as children to protect their families and the future generation. So is the COVID-19 vaccine any more dangerous than the vaccines we are giving to our babies and children today? The measles, the polio, pneumococcal, hepatitis, tetanus, diphtheria, whooping cough, meningitis, pig bell, etc. I'm guessing that maybe many of you have never heard or seen some of these diseases, and this is because of the successful vaccination programs that have existed to prevent such infections. Unfortunately, we witnessed in Samoa a recent outbreak where more than 80 children tragically died because they were not vaccinated. And we also had an outbreak of polio in our country, which led to a mass immunization program across the country to contain the infection. So coming back to the question, is COVID-19 vaccine any more dangerous than the other vaccines? And the answer in short is no. Yet the conversation that is flooding social media, TV, radio, everyday conversations, even at the Buai market, is one of microchips, 5G, autism, neurological damage, etc. And that all drown out the actual facts and benefits about COVID-19 vaccine. Of course, technology and the ease of communication and dissemination of information, especially across social media platforms, is largely responsible for a lot of the misinformation and myths circulated. COVID-19 vaccine is topical, it's new, it's vogue, it's the in thing. The vaccines are under a global microscope in a way modern medicine has never seen before. This attention, coupled with the mass vaccination rates never seen in history before, means potential issues with the vaccine are likely to be exacerbated. To date, 2.8 billion doses of COVID-19 have been administered globally, of which 321 million vaccinations were given in the US alone in 6 months. Compare that with 174 million influenza vaccines given last year as part of the US National Influenza Annual Campaign. We are vaccinating, meaning the rest of the world is vaccinating large numbers of people in a very short time frame. So we can expect to see reports of adverse effects sooner than we would normally see in a normal vaccination program that is over a longer time. And this should not be viewed statistically as more cases, but rather a fast forwarding of the outcomes that would normally spread out over time. Where my parents had to trust the one doctor or healthcare worker or the government of the day with the key health messages, today, my family, my patients, and the community have easy access to other sources of information that can easily misguide and mislead people intentionally. And so that's the challenge that someone like me is up against every day when I go out to advocate for vaccination. I am up against highly organized groups that target a certain disadvantaged and vulnerable population with misinformation that sadly is misleading our people to make irresponsible and poor choices about their health and that of their families. And that is why it is important that people like you and I, who are better placed and knowledgeable, are involved in getting the right messages out to the public. We can safely say the efforts of the government will not be adequate, and it will require the support of the business community and all stakeholders if we are to vaccinate enough people to have some control and hopefully see an end to COVID. Whether this is through supporting vaccine advocacy campaigns, assisting with vaccination programs, through funding, logistics, even to managing and scheduling appointments and data management, a public-private partnership has to be the way forward. Thank you. Did I make it on the time, Anne?
You've got 20 seconds left.
So I should add, nobody's safe unless everybody's safe.
Awesome.